Somewhere in your home, your garage, your garden shed, or your car, there may be traces of one of the deadliest viruses on the planet. You may have already been exposed without knowing. And for a significant number of people, that exposure ends in death. This is hantavirus, and it is not as rare as you think. Hantavirus has existed for thousands of years, carried silently by rodents, primarily deer mice, across North America, South America, Europe, and Asia. The virus lives in the urine, droppings, and saliva of infected rodents. It doesn't need a bite. It doesn't need direct contact. All it needs is for those dried droppings to be disturbed, swept, vacuumed, touched, releasing microscopic particles into the air. You breathe them in. The virus enters your lungs. Most people exposed never develop symptoms. The immune system catches it early. But in those who develop full infection, hantavirus is ferocious. It causes hantavirus pulmonary syndrome, HPS. The fatality rate is approximately 38%. Nearly 4 in 10 people who develop HPS die from it. There's no antiviral treatment. There's no vaccine. Supportive ICU care is the only option. To put that in perspective, COVID-19 had a fatality rate of roughly 1 to 2%. Hantavirus pulmonary syndrome is nearly 20 times more lethal. So why have most people never heard of it? Because it is relatively rare in absolute numbers, around 30 to 40 cases per year in the United States. But deer mice, the primary carrier, are one of the most widely distributed rodents on the continent. They live in forests, fields, rural properties, suburban gardens, and urban outskirts. Wherever deer mice live, hantavirus can be present. The exposure risk is highest in situations most people encounter without thinking twice. Cleaning out a cabin, shed, or garage closed for months. Opening a car that has been sitting unused. Disturbing old wood piles or storage boxes. Working in attics or crawl spaces. Dried rodent droppings may be present. Disturbing them without protection is all it takes. The 1993 outbreak in the American Southwest was the moment hantavirus entered public consciousness. Healthy young adults began dying of rapid respiratory failure. Scientists identified a new hantavirus strain in deer mice whose population had exploded that year. 32 people fell ill. 13 died. What made it alarming was who it killed. Not the elderly, not the immunocompromised. Healthy, young, active people. The immune response hantavirus triggers, a cytokine storm flooding the lungs with fluid, is actually more violent in people with stronger immune systems. The healthier you are, the harder your body may fight, and in fighting, it destroys the tissue it is trying to protect. Symptoms begin 1 to 5 weeks after exposure and feel exactly like flu, fever, fatigue, muscle aches. Nothing in those first days signals anything unusual. Then, 4 to 10 days later, the lungs begin filling with fluid. Breathing becomes difficult. Oxygen drops. The progression from flu-like symptoms to respiratory failure can happen within hours. In 2012, 10 visitors to Yosemite National Park were infected in cabins infested with deer mice. 3 died. Thousands of that summer's visitors were notified and monitored. It was the largest hantavirus exposure event in U.S. history. Most exposures are never traced. Someone cleans their basement, gets flu symptoms a week later, and the cause is never identified. Testing requires specific clinical suspicion. Most doctors will never think to test for it. So what do? First, know the risk situations. Closed, unventilated spaces with rodent activity are the primary danger. Ventilate for 30 minutes before entering. Never sweep or vacuum rodent droppings. It aerosolizes the particles. Wet them with bleach solution. Let it soak. Wipe with gloves. Dispose in sealed bags. Second, wear an N95 respirator. Standard masks let the virus particles through entirely. Third, seal gaps larger than a quarter-inch in walls and foundations. Store food in sealed containers. A deer mouse can fit through a hole the size of a dime. Fourth, if you develop flu-like symptoms within 6 weeks of a potential exposure, tell your doctor explicitly. Early supportive care significantly improves survival odds. The window between symptom onset and respiratory failure can be very short. Hantavirus will not cause a pandemic. It does not spread person to person, but it is present, it is lethal, and it kills people who never knew they were at risk. The droppings in your shed, the mouse in your car last winter. Most people survive without incident, but some don't, and they almost never saw it coming. Next, we're going into your immune system's biggest blind spots, the pathogens it consistently fails to detect until it's too late, and what you can do about it. Make sure you don't miss that one.